I welcome all of you to the Institute for Spirituality and Health. And our speaker this evening is Dr. Ken Pargament. Ken did his Ph.D. work at the University of Maryland, then did a 2-year stint, a fellowship at Johns Hopkins. And in 1979, he went to Bowling Green. Ever since then, he's done about 160 articles and peer review articles, and has made a major impact in the area of spirituality and health, psychology of spirituality and health. Written 2 books. One of them very important, well, both of them are very important. One of them in particular, The Psychology of Religion and Coping. It's one of the most highly cited books in the field. And then his other book is Spiritually Integrated Psychotherapy. So we're delighted to have him come and speak to us concerning spirituality and the spirituality of trauma. And if you will, please welcome Ken Pargament.
Thank you. Well, we're a small crowd, but that way I can kind of relate to you one-on-one here. And even though this is a lecture, feel free to interrupt. If you have any questions or comments, be glad to talk about any issues that come up as you go over this material. This is kind of like a class lecture, but I hope you'll still find it interesting and informative. Let me start off by just giving you 2 examples that highlight one of the points I want to make. Here's the first example. These are from the words of a bereaved mother talking about her child. And she says that she talks to him all the time. I keep him up on what's going on at home and with all of us. I feel the strongest connection at the cemetery. I imagine his spirit in the trees behind his grave. When I begin to talk to him, the wind almost always rustles the leaves, which tells me he's there. Here's a woman who gains tremendous spiritual support from a sense of connectedness, attachment to the spirit of her child who's no longer alive. Tremendous value for that, and she's not alone. This isn't unusual. Many people have continued attachment to their lost ones, their lost loved ones, and it plays a very significant role in their lives. Take a look at, by contrast, the words of this survivor of sexual abuse. And he's talking about how God didn't protect him either. And says, why would God not protect a helpless little boy? It wasn't fair. Instead of welcoming and embracing Jesus as I want to, I'd really like to knock him down. I'm mad at him, and I'm mad at his father. 2 very different perspectives on religion and on faith. And that's one of the main points I want to make here, is that really spirituality is, first of all, an integral part of trauma, the way it's understood, the way it's handled. And it may be a source of solutions, but it may also be a source of problems. It's this double-sided nature to spirituality. Let me put this into this work on religion, stress, trauma, and coping into kind of a historical context, because it's more of an academic kind of talk. I thought you might find this kind of interesting. Historically, theorists and researchers have talked about people having a common response to stress. For instance, Durkheim talked about suicidality as a response to social disintegration. And so he noted, for instance, he had these interesting statistics in Europe that showed that suicide rates are higher among more socially disconnected people, the unmarrieds in Europe at the time. Hans Seily, a physiologist, studied organisms under stress and said there's a common response of organisms to stressors. He said the common physiological pattern, and I don't know, to toxic substances, he said it was adrenal enlargement, gastrointestinal ulcers, and thymico-lymphatic shrinkage. I don't know what thymico-lymphatic is, but it sounds pretty significant, and I sure wouldn't want to have it. Okay? Later, he defined what he called the general adaptation syndrome, which he said is a universal response to stress, which has different reactions or stages of alarm, resistance, and exhaustion. And it's in response to everything from allergens to germs to physical trauma, overcrowding. He said animals and human beings go through this universal response to trauma. Psychiatrists identified a common pattern of response to combat exposure in World War I and World War II. They called it initially a shell shock, then it became combat neurosis. Now today we talk about PTSD. But Brinker and Spiegel, who were famous psychiatrists working with soldiers at this time, said that if the stress is severe enough, if it strikes an exposed Achilles heel, and if the exposure to it is sufficiently prolonged, adverse psychological symptoms may develop in anyone. Basically saying that we're all vulnerable to the effects of intense stress or trauma. In this case, I'm talking about combat. Psychiatrist Eric Lindemann studied grief reactions among survivors of a terrible fire at the time, the Coconut Grove nightclub fire. He also studied combat veterans and hospitalized patients. And he said there's a uniform syndrome of response. He defined it in terms of sensations of somatic distress occurring in waves lasting from 20 minutes to an hour at a time. Feeling of tightness in the throat, shortness of breath, need for sighing, an empty feeling in the abdomen, lack of muscular power, and intense subjective distress described as tension or mental pain. So we have this tradition of theorists seeing a common response to stress. And it was expressed in a research method through the work of Holmes and Ray, who developed what was called the Social Adjustment Rating Scale. And basically it's a list of life changes that people may have experienced. Death, illness, accident, positive changes too, marriage, birth of a child. And what they found was that people who had more life changes were more likely to develop physical and emotional problems. This is a famous set of studies that came out in the 70s, early 70s. Now, many theorists, though, and researchers took issue with this notion that stress leads to a common response. One physiologist really critiqued Siley in his general adaptation syndrome, and I just love this quote. This is a guy named Hinkle. I love this quote. He said, "During the course of their adaptations to the social environment, direct neural regulatory effects upon their organs can produce such pronounced phenomena as," and this is the part I enjoy, "variations in bowel function ranging from complete constipation to continuous hypermotile diarrhea." I'm not quite sure what hypermotile means, but again, it doesn't sound, it sounds like I'm the equivalent of lycospasmophysitastic, whatever it is. Variations in heart rate ranging from transient sinus arrest to sinus tachycardia greater than 180 per minute. Changes in blood pressure ranging from transient hypotension without detectable blood pressure to systolic pressures greater than 200 millimeters of mercury. So he's saying that the same stressor can produce these dramatically different responses in people. Another argument against the common response notion is the work that's been done looking biographical work on some famous figures like Samuel Clemens, Theodore Reiser, Chekhov, Tolstoy, Eleanor Roosevelt, Clara Barton. Remarkable people who, if stress produces invariably these terrible outcomes, they shouldn't have done very well. Well, they had poverty, abuse, broken homes, dominating parents. They had lots of problems. And in spite of that, they seem to do pretty darn well in many respects in their lives. I think the most compelling evidence about the limits of this stress produces invariably trouble is the research that shows that the correlation between exposure to major stresses in your life and subsequent problems, physical health, mental health problems, is statistically significant, but it's really small. So the more stress you have in your life, the more changes, for instance, you've had in your life over the last year, it is predictive of poorer health and well-being, but the correlation is like 0.1 to 0.2, which basically means that there are plenty of people out there who've had a lot of stress who are doing just fine. And there are also plenty of people out there who've had very little stress who are falling apart. So that raises the interesting question then, what the heck is going on? People aren't invariably damaged by exposure to stress in their life, and that understanding led to the research on coping. And the notion of coping grows out of the realization that whether people are damaged by a trauma seems to depend on the way the trauma is understood and handled. There's a person in between the stress and the response, a person with a mind. And how the person understands the stress, how the person responds to the stress, makes a big difference. Let me give an example here. Consider a woman who's discovered a lump in her breast. Okay? How will she understand and deal with it? Well, maybe she does it in constructive ways. And here are some positive ways of coping with that scenario. I just listed a few of them. Make a doctor's appointment. Get some social support. Call up family or friend. Self-talk. Try to reassure yourself. Exercise. Healthy diet. Staying active. On the other hand, we can also choose to do some things that aren't so effective. We may not think of these as ways of coping, but they can be understood as ways people try to come to terms with difficult situations. And often in my own classes, I ask my undergraduates, so what are the ways that wouldn't make sense of coping with problems? Let's say you get a poor grade. And I talk about what are the good ways of coping with it and the bad ways, and they kind of struggle with the good ways. The bad ways, boy, they've got them all nailed down. Things like ignore it. So you have a lump in your breast, just pretend it's not there. Hope it'll go away. Again, just kind of denial, distraction. Panic. Have a panic attack. Tell yourself you're going to die. So catastrophize. It's another way some people cope. Keep secrets. As opposed to social support, start drinking. I'm worried about it. I'm going to go out and I'm going to get bombed tonight. These are all ways of coping. I think I may have had one more. Do I have one more? Yeah. Take your frustrations out on other people. Another classic way of coping. Again, these are all very ineffective. Now, whether there's a positive or negative outcome to the situation, the research would say, and it makes sense to us, it's going to depend on how you cope. I mean, just consider these as two different trajectories or two different pathways. The resolution of the situation is going to depend on the way of coping. Now, unfortunately, for a long time, much of the research in the area ignored one particularly important coping method, which is religion. When I started doing this work, there's very little research on religion's role in the coping process. In I think it was 90, let's see, I think I have it here, in 97, before 97, there are 200 empirical studies on religion and coping. And since then, we've got over 1,000 studies. I can't keep up with it all now. They're just developing so rapidly. So with that introduction, let me say a little bit about what we know about religion and coping. Any questions about any of this first? Any thoughts or reactions to that? No? Okay. Well, we hear a lot of popular sayings that speak to this kind of curious affinity between religion and trauma. Man's extremity is God's opportunity. Okay, so in extreme times we'll find God. There are no atheists in foxholes. It's another popular one. My favorite one I came across a while back is, "Dear God, help me get up. I can fall down by myself." It seems very apt, I think. By the way, I should note that that old saying that there are no atheists in foxholes is inaccurate. We can find atheists in foxholes. One survivor of a concentration camp was interviewed, and he had this to say. He said, "I never believed in God, not before the Holocaust, not during my stay in the camps, and not afterwards. I didn't need the Holocaust as proof of God's non-existence. I was never in doubt that he didn't exist." So, stable disbelief. And it's not unusual. Many people enter a situation as atheists and remain atheists through the situation. But it is true that religion does tend to come to the foreground in life's most difficult moments, as we saw following 9/11, when 90% of the American population was seeking support from prayer. There were mass religious services. People came together religiously to express their desire for comfort and for support. More systematic studies have shown that people often turn to their faith in coping with difficult situations. So, for instance, black and white elderly women with medical problems, in this survey, prayer was their most frequent method of coping. More frequent than any other method that they might have used. So how do we explain this affinity between religion and coping? Well, I'd suggest that times of trauma are times that reveal to us our basic humanness, our basic limitations as people. When we realize we're not infinite, we're not super people, we're frail, and we're vulnerable. And these are the times when we may be confronted with the inexplicable, the irresolvable, just our human limitations. So we're revealed in these traumatic times as being insufficient. The chaplain and pastor, the founder of pastoral education, Anton Boysen, I really like the way he put it. I actually used this quote this morning in a talk. He said, "As one stands face to face with the ultimate realities of life and death, religion and theology tend to come alive. Meaning tends to outstrip symbol, and we have to seek for new words to express the new ideas which come surging in. Among these ideas, we frequently find the sense of contact with that ultimate reality to which we give the name of God." Isn't that a neat quote? That's a great quote. But what he's saying is, in these times that reveal to us our own human frailty and insufficiency, we end up seeking something larger than ourselves, something larger than even the medical system, because that too is insufficient. It's only human. And so we look for something larger, something deeper. And that's when many people do turn to religion. So, having said that there's this connection, I don't think it's enough to note there's a connection. We have to take a look at, well, how is religion involved? And here I make the kind of, some people find it challenging, notion that it's a double-edged sword. Religion can be involved for the better, and it can be involved for the worse. Let me talk about the positive first, and then we can talk a little bit about the darker side. On the positive side, religion serves a number of functions. And we're going to go through these functions, and I'm not going to suggest that we have to pick one as the winner. I think part of the power of religion is that people who have different needs, motives, weaknesses, vulnerabilities, they can find a home in their religion because it offers things for different people with different needs. For some people, they look to their faith primarily for a source of meaning. How do you make sense intellectually, cognitively, of loss and trauma? I love this quote by Clifford Geertz, who's an anthropologist, studied many different cultures. He says, the effort, he's talking about religion here, the effort in religion is not to deny the undeniable, that there are unexplained events, that life hurts, that rain falls upon the just, but to deny that there are inexplicable events, that life is unendurable, and that justice is a mirage. So he's saying that religion is really all about denying that you can't somehow make some sense of it all, or the underlying feeling that there may be sense to be made, even if you can't make sense of it. As one of my, I have a colleague of mine, a friend of mine, who's an African-American minister at Baptist, an AME minister in Toledo, and he's always challenging me why I haven't converted to be an AME member. And I've been to his church a number of times. He's a great guy, and I think if I were to convert, I'd go to his church because it's such a great place. But he's always on my case. So I said to him one time, I turned down the tables on him. I said, Dolphus, tell me, how do you make sense of some of the things that really challenge your own theology? He says, like what? I said, well, like slavery. You know, we're talking about really some serious business here. Families torn apart, people murdered, you know, a whole culture, you know, fundamentally shaken and shattered. How do you make sense of that? And he says, well, to tell you the truth, I can't. But I know when I face the Lord, He'll have some answers for me. Okay, so he doesn't have answers, and yet his answer is there's still an answer. He just needs to wait to get it. He has faith that there is an ultimate meaning. And that gives him a security that there's an ultimate meaning, even if he can't grasp it himself. A couple of other examples on this. An example from a bereaved mother, and then she speaks very similar to Dolphus, my friend. She says, there is a God, and it's an explanation that there's no explanation. Okay? A paraplegic, a young paraplegic boy who had injured himself in a swimming accident said, it's a learning experience. I see God's trying to put me in a situation and help me learn about Him and myself and how I can help other people. So through religion, the negative experience, the trauma, is reframed in a more positive, benevolent light. And there's evidence that this is successful. For instance, one study showed that this was a study of parents who'd suffered the violent death of an adolescent or young adult child. And the study found that religious coping, and I'll share the way they measured it here in a bit, was predictive of finding greater meaning in the child's death 5 years later. So people who had some kind of faith system were able to experience greater meaning about the loss 5 years later. That's a major purpose of religion. It's actually the purpose that social scientists tend to emphasize. There's writing, for instance, that really says that some social scientists maintain that that is the function of religion. Some people say religion really is a search for meaning. I think that overstates it. And in part, I think it's autobiographical or projective. I think we, as social scientists and medical professionals, we're so in our heads that we tend to emphasize that function. We emphasize the being in your head function because that's what we do. But that's not true for everyone. For some people, they're just not interested in questions of meaning. That's not what they're about. They approach religion for other things. For some people, religion's all about community. It's all about relationships. And Durkheim is one who emphasized that, who said, the idea of society is the soul of religion. Here's a good example of it. This is a priest that we interviewed after the death of his mother. And you listen to the way he describes the funeral of his mother. He says, the funeral was astounding. The whole church, everybody was there. Many, many friends were there. Students from here, and the liturgy was a real experience of the resurrection. It was terrific. My blind niece played the piano, and my best friend David gave the homily. So there are so many powerful spiritual expressions and family expressions. It's hard to separate one from the other. Spirituality and community. You know, here he loses a pivotal figure in his life, and yet he sustains his connectedness to a community through his faith. He's not talking about meaning. There's nothing about, I don't see anything obvious about meaning here. I hear a lot about relationship. And that's what he's deriving from his faith. And again, there are plenty of studies that highlight the fact that people who are more involved in religious institutional life experience a lot of benefits. It buffers the effects of poor physical health, depression, and it provides a sense of support and identity. Religion can also provide emotional comfort, and I think many people look to their faith for that basic function. This is what Freud emphasized in his writings, that religion is designed to reduce the sense of terror and anxiety that the child feels when recognizing the parents unable to master the superior powers of disease and cataclysm and death. Again, not hard to find examples of this function. I came across this study done. It's really a nice study in 1926 in the Journal of Psychology. I remember, I think many years ago, I came across it just walking when I used to walk through the stacks of libraries for fun. That's what I do for fun. And I found this article, and it was a content analysis of Protestant hymns. They took 3,000 Protestant hymns and analyzed the themes. I'd like to have met this guy young. He must have been an interesting person. And found that 1/3 dealt with the theme of comfort by a loving, protecting God. That was the theme of 1/3 of the Protestant hymns. Very, very interesting. One mother at the bedside of her ill child kind of describes this in very physical terms, the sense of emotional comfort and peace. She said, it was almost like someone had thrown a soft blanket over me. There she is, suffering by her ill child. I felt a tremendous sense of peace. I tell people I felt the peace of Christ. Physical. It's like a physical presence, a physical comforting. Now, these examples are merely illustrations. We could talk about other functions of religion. Certainly, religion also helps people control impulses. Lots of good data showing that people who are religious tend to drink less, use drugs less, less promiscuity, less gambling, less violence. So religion constrains impulses, again, consistent with Freud's theory. And it's also a source of efficacy and personal sense of power and personal transformation. And again, I'd say part of the power of religion lies in its ability to serve multiple functions. Many people can find answers to their questions beneath the same religious, within the same religious home. But all of these functions overlook what to the religious person is the most important function, which is feeling a sense of connection to something larger than oneself, God, the sacred. And Paul Johnson, the psychologist of religion, said, it's the ultimate thou whom the religious person seeks most of all. There's this ultimate thou, something larger than oneself, something transcendent, something that goes beyond oneself. And I've often shown this slide, but I like it a lot. And it's a 9-year-old child talking about his search for God, saying he wouldn't just be there waiting for some spaceship to land. He's not a person, you know. He's a spirit. He's like the fog in the mist. I should remember that God is God and we're us. I guess I'm trying to get from me, from us, to him with my ideas when I'm looking up at the sky. You get that kind of searching, that kind of seeking quality for God in a 9-year-old. Isn't that neat?
It's amazing.
Isn't it a good quote?
Astounding.
Yeah.
Is that from The Spiritual Life?
Yes, The Spiritual Life of Children, Robert Cole. He's got other great examples. But you can find really great examples of even younger kids. And if you just sit down and talk with them, it's amazing what kids start to talk about in terms of their religion. Kids are incredible that way, and I think our theories tend to underestimate the spiritual propensity of children. Actually, there's some very interesting cognitive psychology research now that shows that the development of God ideas seems to be a capacity that even the young, as early as we can measure it, we can find it. In fact, what seems to happen is we seem to be kind of programmed to have that capacity for belief from the first of life, and we tend to think, for instance, of parents as godlike when we're very young, as well as gods as godlike. But what happens is as you age, parents lose their godlike status, and kids hold on to the notion of God. And that's showing up in cognitive studies. Kids at 5 start to think of their parents as less godlike than they at 4. So they start to think about parents in more realistic terms. And doesn't that fit with experience? You know, I'd like to see them continue it through adolescence. And boy, is there a sharp decline there. Okay. Okay, so let me shift gears here then to talk about what is it then that people do with their religion to cope, shifting from the function of religion to the concrete things people do religiously to cope. And we've done a lot of work in this area. And to try to answer that question, to try to measure specifically what it is people do with their faith. How does it come to life? In the past, it was measured by only a few items, like how often do you go to church? How often do you pray? But that really doesn't provide a very sharp picture of what people do with their faith in times of stress. But if you talk to people about it, it's not hard to find the language by just talking to people. If you ask them when they're going through a rough time, so tell me, how has your faith, your spirituality been involved in the way you've understood or dealt with your situation? You can ask that question to anyone going through a tough time with physical health, mental health problem, and they'll tell you. For instance, this mother says, this psychiatric patient says, I have no motivation to do anything, so I pray. I offer my suffering to Jesus. He gives me strength and comfort to do things. That's typical kind of language when you ask people to start talking about their faith. People can speak about it in very powerful terms. Well, building on this kind of language over the years, we developed our own measures of religious coping. And just to give you a sense of some of these items, and again, these items really come from the words of our participants. That's why I think this is really the most frequently used scale, and I think in part because people resonate to it, it comes out of people's own words. So, spiritual support. It's like, so how are you dealing with the situation? We ask people to check whether they sought comfort from God. Where did we get that language, sought comfort from God? Well, we interviewed somebody who said, when I'm having trouble with my family, I seek comfort from God. Well, thank you. We're going to take that and use it. Benevolent religious appraisal. That didn't come from other people. That's what happens when you get a bunch of social scientists working in this. But here's the language other people use. I tried to see how God might be trying to strengthen me in this situation. That's a positive religious appraisal. And that's what many people do in difficult situations with their faith. They tend to see it from a benevolent, larger framework of meaning. Spiritual connection. I thought about how my life is part of something larger than myself, a larger spiritual force. People say that. Religious support. How'd you deal with this difficult situation? I asked other people to pray for me. You can get people to say that. It just rolls off their lips. Now, numerous studies have shown that these kinds of items are predictive of positive results among people going through tough times. These are positive ways of coping generally. Here's one study from a colleague of mine, Gail Ironson. Oh, that's another one I just want to mention. This is one that's often overlooked. How did you deal with your difficult situation? Well, I tried to provide other people with spiritual comfort. That's really important. It seems to be a real positive religious method of taking your situation and your pain and using it as an opportunity to give to other people. So does this work? Well, Gail Ironson, she's a psychiatrist at Miami University. She studied 100 HIV patients over 4 years, and she used items like this and found that, for instance, people who view God as loving, looking to God for support, were more protected against declines in CD4 cell counts. Just a very strong kind of finding. She's got other findings with her sample that show the real beneficial effects of positive religious coping. So it's just one example of the neat findings that have come out. Okay, you may say, well, why do you have to be so complicated? Why can't we just look at how often they go to church or how often they pray? Well, the reason you have to get more complicated is people go to church for all kinds of reasons. And they may have little to do with coping, or they may not involve positive coping methods. People pray for all kinds of reasons. I mean, people can pray for all kinds of reasons in all kinds of ways. I was just joking with John about someone praying that someone who's giving him trouble, that they get hit by a car. You know, it's not enough to know that someone prays. You have to know how they pray, what they're praying for, what purpose it's serving in their lives. So all of this says that the metaphor I use is sometimes think of prayer and church attendance as channels on a television. But they're really not very predictive of what you're going to find. You have to know what's the program on the channel. Just knowing the channel may not tell you a lot unless you're comparing CNN to Fox News. But most of the time, knowing the channel doesn't tell you a whole lot. You have to know what's the program. And the coping methods here are the programs. They're the particular programs. Okay. So the take-home point is what matters is what you do with your faith. It's not enough to say you're religious or that you have a faith. What do you do with it? How does it come to life? All right. Well, there's a darker side. And the fact is that trauma can impact people not only psychologically, socially, and physically, but also spiritually. And my own interest has been in studying spiritual struggles, which are expressions of tension and conflict over sacred matters within oneself, with other people, or with God. For instance, we can talk about intrapsychic struggles or intrapersonal struggles. These are struggles that have to do with conflicts about theology within yourself, theodicy, or feeling you're not living up to your faith, id, superego conflicts. And Job was having an intrapsychic struggle among many. He was, when he says, "Wherefore do the wicked live, become old, yea, are mighty in power." I mean, it's not fair. He's saying it's not fair. He's struggling with issues of theodicy and theology here. And we can find modern day examples. This was an adolescent. I love the quote. She said, "Is Christianity a big sham, a cult? If an organization were to evolve in society, it would have to excite people emotionally. It would have to be self-perpetuating. It would need a source of income. Christianity fits all of these. How do I know I haven't been sucked into a gigantic perpetual motion machine?" It's a struggle. Great intrapsychic struggle. We have interpersonal struggles. And this is an example of again, a young man who's angry about, actually this was clergy sexual abuse. And he says, "This guy had my soul in his hand. It was devastating to know that someone would step out of the powers of spiritual liberty to take over someone else's soul. I still have anger about a lot of that, and I think more of the anger is about the spiritual loss than anything to do with the sexual abuse." I mean, that captures an important point, that the spiritual loss may be as powerful as any other loss. The anger at the violation by someone who is supposed to be a sacred figure. That can be really key here. That's an interpersonal struggle. It creates a struggle between the person and other religious figures, struggle with the person and the organized religion or a church. And then there are struggles with the divine, as we see in the Psalms. My God, why hast thou forsaken me?" And in the last words of Jesus on the cross. And I've used this example, too, of my own undergraduate student who sent me an email. She had bipolar illness, who wrote to me describing her suffering. She said, "I'm suffering, really suffering. My illness is tearing me down, and I'm angry at God for not rescuing me. I mean, really setting me free from my bondage. I've been dealing with these issues for 10 years now, and I'm only 24. I don't understand why he keeps lifting me up just to let me come crashing down." Again, it's not hard to measure these struggles. We've used these kinds of items that come out of the words of people about how their faith is involved in coping. And, very simple kinds of questions. How are you dealing with this situation? Well, I'm wondering whether God's abandoned me. I feel punished by God. And anyone who's worked with people in any clinical situation, if you ask the right questions, you'll get that. I'm feeling, someone has a major illness or a trauma or a mental illness, I'm feeling like God's punishing me. It comes up. I wonder whether God really loves me. I really feel my congregation's abandoned me, which comes up too. Well, how can those people have abandoned me when I was there for them? Again, because spiritual beliefs and practices and values lie at the very core of who we are, when we experience these struggles, they have, I think, profound implications for our well-being. And in fact, that's what we find. For instance, in the study of multiple myeloma patients, the religious struggles, we call it negative religious coping, was tied to greater fatigue, pain, clinician and self-rated depression and distress. No other measure was related to mental health. Struggle was the measure that was most related to problems, and we find that in a number of studies. If you want to get a religious variable that's predictive of mental health, use the struggle measure. Struggles are a sign of real trouble, and the findings are very consistent. In a longitudinal study, Harold Koenig and I found that hospitalized patients over 55, those who struggled at baseline, were more likely to die 2 years later. Struggles also predicted depressed mood and declines in physical functional status. But the struggles with the divine were predictive of greater risk of dying. Very striking kinds of findings. I don't know if I have that. Yeah, and these are the items that best predicted. Feeling abandoned by God, questioning God's love, and feeling the devil's involved in the illness is predictive of mortality. I should add, we now have 3 or 4 studies that show that struggles are tied to changes in immune status. So we've been able to follow in a couple of studies of HIV patients, CD4 counts, and studies of heart transplant patients too, with some immune functioning indicators there. We get struggles related to declines in immune status over time. So it's suggesting some physiological pathways between struggles and the declines we're seeing in physical health. It's really the first negative religious variable that's been identified that has some legs, that shows its impact on health and well-being. I should note, we also have a little bit of data saying that some people seem to grow from their struggles. As a psychologist, and that's something we often tell people, you can grow from your pain. You can take this pain as an opportunity to grow. And I believe that's true, but the data here are sobering. And they're suggesting that for many people, their struggles are not growth-producing. For many people, they struggle and they decline. That's, I think, just a reality that at least these data are suggesting.
Can I interrupt?
Yeah, sure.
Do you have you researched interventions, the impact of interventions in these struggles, and whether they might alter those outcomes?
Yeah, we're just starting to do that. We've done a couple of struggle interventions now. We did it with college students who are, in fact, very prone to struggles, leaving the family and coming out of the security of the family and then entering this new free space where you can do anything you want. And there are lots of people doing anything and everything that they want. So it creates this intrapsychic struggle for many of them. A lot of guilt, shame, and there are also struggles with their families because their families are sensing that they're experimenting. So there's interpersonal religious struggles, and they're really quite significant. They've been tied to depression, suicidality. So we developed a spiritual struggles group for college students called The Winding Road, where we got students together to talk about their struggles. And then then they learn they're not alone. We normalize struggles. And then give them resources for dealing with it and understanding it. And in really a short time, 8 sessions, we were able to actually show some pretty dramatic change. So that's one of the first things we've done. We've also done an intervention with HIV inner-city disadvantaged women, where we developed the intervention particularly for this group, and also had some success with it over 10 sessions and showed declines in depression, declines in religious struggles too. So it's ripe for intervention. Chaplaincy work chaplains have also begun to do some work on struggles and to show that their connections with patients in the hospital just the contact with them can reduce their spiritual struggles.
It just seems to me, this is very impressionistic, that working with patients in psychotherapy and addressing these directly or even not, when their relationship struggles and it's a chicken-egg issue, I guess, but these struggles seem to abate when people get more settled in their relationships and address their conflicts and so forth.
Well,
including these conflicts.
we've distinguished between what we call secondary struggles that are secondary to the illness. And we have data showing that virtually every form of psychopathology is tied to struggle. It's not that we believe struggle produces every type of psychopathology, but that when you have significant serious mental illness, that can trigger a struggle. And it can be, if it's a serious personality disorder, bipolar disorder, schizophrenia. So that seems to be the case, that for many people struggle is secondary. And if that's the case, then treating the primary illness should help mitigate the struggle. And in fact, I think there's some suggestion that that does happen clinically. I think, as you're describing, sometimes you work with someone who's deeply depressed and they're starting to question their faith and religious community, you help them with a depression, and all of a sudden they're feeling more connected to God and the church again. But we also distinguish what we call primary struggle. And that's the case where the struggle itself may elicit distress or illness. And we have some examples of that too in our longitudinal research of people who encounter struggle for other reasons. And struggles are primary. They seem to be causally related to subsequent distress. And in those cases, we're thinking, boy, you better address the struggle, because just treating the illness may not be sufficient.
Yeah, I'm thinking more closely related, because these are relational problems. And so addressing relational problems that are kind of parallel here in relationships is more of a direct connection. These are great research questions. I don't know. If you address the relationship issues, for instance, if there are underlying relational problems or attachment issues or early childhood issues with family, and you address those, does that do the trick for struggle? Yeah, it's a great example.
Again, if you think of the primary versus secondary, I'd say, well, I think that might work for a secondary struggle. A primary struggle, I think if it's a primary issue in and of itself, and for some people, I think their questions about faith are primary, and they can't really be resolved fully other than by addressing them directly.
Yeah.
So those are the cases that we may need a chaplain, a spiritually trained counselor who really can work with them around their understandings of God.
What sorts of things trigger the primary struggle?
Well, again, great questions. We're actually doing a longitudinal study now to take a look at it. We think there's some personality factors involved. So there are people who may, for instance, on the Big Five, if you look at the neuroticism scale, that neuroticism may be one of the factors that triggers it. Lack of a strong and deep religious background can trigger it, because you don't have much of a framework to protect you when you face existential challenges and issues. Or major life traumas can trigger struggles. So as military service, being exposed to a major set of repeated traumas can throw anyone's theological framework into question and doubt. So, I've seen pastors and ministers come in with profound spiritual struggles because they've experienced multiple deaths, illnesses, and injuries within a short period of time, and they're coming in saying, "I don't know what I believe anymore," and they don't have much background in terms of any background of psychopathology, but they're sure struggling. That would be a good one for primary struggle. So let me kind of talk a little bit about that question of what determines, among people who are experiencing struggles, what determines whether the struggles are going to lead to growth or decline. And this is a question I'm really interested in. And my answer I have is not simple. And I think of the notion of a well-integrated spirituality as being pivotal. I can't say, well, you just need to do X, Y, and Z, and that'll help you grow from your struggle. I think you need an integrated spirituality. And what do we mean by that? Let me just pick a few dimensions out here, and to save some time, I'm going to skip over. The degree to which spiritual integration is the degree to which spiritual knowledge, practices, experiences, relationships, and goals are organized into a coherent whole. Now, that's very vague. But all I can tell you is I'm about to go hear the Houston Symphony. Now, are they going to do a good job? Well, how do you decide if they've done a good job? I'd say you have to look at the whole. You have to look at, a lot of things have to come together. You have to pick a piece of music I like, but I mean, if they do that, then they've got to have great musicians. They have to play together. They have to have a conductor who can help to organize it. And if you don't have everything coming together, clicking in harmony, literally in harmony, then any one of those bits or pieces gets out of whack, then the whole thing it's not very pleasurable. It's kind of like that with spiritual integration. Let me give you a few examples of what may go into it. I'm just going to skip around to a couple of them here. The notion of being discerning versus undiscerning. And this has to do with the idea of knowing when to do what with your faith. It's not as if I think there are too many, there are very simple bromides or easy kinds of rules that we can apply that just do A, B, or C. For instance, if someone comes to you, and the case I use a lot is a woman comes to you who's been living with an abusive partner, and God comes to her and says, in a dream, and says, if you go back to your abusive partner, I'm going to make everything okay. What do? God is taking control. In that situation, I'd have problems with it, because I'd say that that's not well tailored to the situation, because that situation, to my mind at least, involves some personal initiative and autonomy on her part to do something about it, rather than rely purely on God. Now, maybe I'm being presumptuous, because maybe if she goes back, God will, in fact, take care of it for her. But at the very least, I'd say she's still not stepping up to her part in a relationship with God, and I'd encourage her to do that. On the other hand, if someone came to me who's dying with terminal cancer and said, I had a dream, and God told me to turn it over to God at this point, to let it go, I wouldn't respond the same way, right? Because that seems to me to be discerning. So knowing when to do what. And we listen for those kinds of things all the time in clinical work. We're always listening for how well is our patients, how discerning are they in their life situations. One other example I'll mention is flexibility versus inflexibility. Does the religious framework or the spiritual framework have the capacity to adapt, to change, to grow? Or is it stuck? Is it fixed? Are you still living the same exact faith that you had when you were 5 years old? And are you going to be living it when you're 75 years old? Or have you seen some change and growth? And in fact, I think life insists on some change and growth to deal with difficult life situations. We found in our own research, for instance, that people who are chronic strugglers, people who get stuck in their struggles, are at the most risk for trouble. People who struggle briefly or acutely, oftentimes it's just a sign of a secondary struggle or an immediate problem that just passes with time. It'll just fade. Someone who feels God's punishing them. You may experience it for a short period of time, but then you're done with it and you move on. There are people, though, whose struggles do become chronic. People who, and one of my colleagues was telling me about someone she had worked with who had been involved in some behind-the-lines work in World War II, and some pretty murderous type of activity. And this guy had lived his whole life convinced that he was going to burn in hell, and that there was no relief for that, no redemption. He lived his whole life like that. He was a chronic struggler with it, and he had not gotten any help over the course of his life. And she was tremendously upset that he had gone through a lifetime living that level of pain and suffering. Okay, let me just kind of conclude here so we maybe have time for a little bit of... one other thing I'll mention is whether people's struggles are met with support versus or stigma. This is an example of stigma. A mother responding to the introduction of evolution to a university's curriculum. She said, if my daughter's faith is shattered or shaken, I'd rather see her dead. That's not real supportive. Okay? On the other hand, I came across this that I thought, any of you ever read the book Father Joe? It's really great. Yeah, wonderful story. Anyway, Tony has this experience. He grew up and he was very close to God, but he has this dream one night where he's falling through like an elevator shaft. And as he's falling through it, he realizes there is no God. And he wakes up totally shattered. He has this wonderful friend of his who's really a substitute figure, who is Father Joe, a priest. And he goes to see Father Joe. And Father Joe offers him this support for his struggle. And he says, God gave you a great gift that terrible night, Tony dear. He gave you a vision of hell. Not that silly fire and brimstone stuff. True hell. Being alone with yourself for all eternity. Only your own self to hope in. Only your own self to love. As you said, a prison with no door. I don't think that vision will ever come to you again, but you must never forget it. Isn't that kind of neat? You know, that type of support. And kind of reframing of his experience, too, of the suffering he's experienced of really being when you're just disconnected from attachments and relationships. That's where the real suffering comes. And so helping him maintain some kind of view of God with that. Anyway, conclusions, the take-home message: trauma is spiritual as well as psychological, social, and physical. It elicits spiritual issues for better or worse. It may reveal powerful resources, and it may shake and even shatter our spirituality. And we can't provide effective care to people unless we address the spiritual dimension of trauma. John, your question is the question I was going to end with, which is, how do we then take all of this knowledge into the development of more spiritually sensitive treatments? How do we approach spirituality then in treatment? That would be another set of talks. But I thought you might find this material interesting tonight. So other comments, questions, thoughts about this work? It's really kind of burgeoned in the last 10, 15 years, so we're really seeing some. I can't even keep up with it all now. Yeah, Bob?
I'm trying to synthesize this into my own thinking to summarize it. It seems that the real struggle in all of these struggles almost comes down to having a synchronization between your worldview and your intellect and your heartful, felt, perhaps emotional or spiritual view in your heart, and getting those in sync. And when they're not in sync, to me, that quite often is what leads to the trauma that I see in people that I'm dealing with. Does this view or these words resonate with what you're
Well, I think that speaks particularly to the intrapsychic, intrapersonal struggle. But I think all struggles have to do with a lack of connectedness, either within oneself, with oneself and other people. There's a disconnect there that you can't talk to other people about spiritual issues. A colleague of mine, Annette Mahoney, and I, we've got some longitudinal data that show that difficulties talking about spiritual issues with your spouse are predictive of all kinds of things in your relationship down the road. And they predict better than general communication. Being able to talk about the most intimate matters about God and faith and spirituality, being able to talk about that with being able to be vulnerable about it and all that, is a really important predictor of subsequent success in the marriage. So that's another side of it, the kind of disconnect with other people. And then there's that sense of disconnect with your representation of God, feeling that you and God are just not connected. We're not clicking. God's abandoned me, God's mad at me, God's punishing me. Or there's a negative spiritual force. The devil's out there, and the devil's doing me in right now. So I think it is a lot about lack of wholeness or disconnection. Yeah, Tim.
And may have misunderstood something you said earlier, misquoted you, I'm not sure what, but in the Winding Road study, the end point of that was abolition of the struggle, or?
Great question. No, that wasn't our goal. Our goal was to help them be able to normalize the struggle, talk about the struggle, accept struggle as a part of life, help them place the struggle within the context of their their greater life journey. We actually didn't even predict that our program would reduce the struggle. In fact, it did. That wasn't the goal. We wanted to reduce the distress around the struggle. We wanted to, and it did that even better. So by the end of the program, people were able to struggle with less anxiety about the struggle. It's kind of like a mindfulness about the struggle. You can have it, but it's okay. It's something you can hold in your hand and you can watch it, and it comes and goes like everything else in life. We seem to create that type of, or foster that type of experience. But yeah, I mean, in my own theory, I think a struggle is a natural, normal part of spirituality. And the findings that I've been getting, that struggle is tied to such distress and greater risk of dying and all of that, that's been surprising to me, that it's so powerfully, all these disadvantages to it. And the weaker evidence that is tied to growth, we only have little glimmers of that, which is what I expected. That struggle will lead to growth. So
I think I misunderstood something you said. I thought a few minutes ago you said that the struggles were problematic in and of themselves, but it's the distress related to the struggles.
Yeah, I think that would be a better way to put it. That there's distress related to it, and there's no place to put the struggle. There's a lack of support for the struggle. That's why I didn't end with struggle. I ended with, okay, what determines whether the struggle is problematic or not? Then you have to turn it to a whole other level of concerns, which, again, this gets kind of rich and complicated. But again, I think there's something to it. That there, in the spiritual world, like any other dimension of life, physical, psychological, social, here are the 5 things you need to do to be well. If they're there, then I sure haven't figured them out. You did.
I was wondering, back on your comment on the bereaved priest and that quote there, and there's, you didn't really see any meaning in there. And I'm just wondering, the whole process of articulating the event, does that lead to meaning? It's just verbalizing it, telling the story. It's similar with the student group.
Right. Right.
Coming together and just telling the stories.
Yeah, I mean, the narrative, the telling of the story could be ultimately serving a meaning-making purpose. Right. On the other hand, let me just suggest that we tend to kind of try to translate experience into our favorite explanatory mechanism. So you might see this, I don't know if this is your favorite explanatory mechanism, but you might be arguing that ultimately it comes down to meaning. Freud might say, well, ultimately it just comes down to anxiety reduction. This is just another way to make yourself feel better, that's all it is. And someone else might say, it's ultimately all about community. What I'm suggesting is there's no need to get into that debate, because the simpler explanation is people look for different things. People have different motives. And isn't that the case? Don't we seek different things out of life? Are we all motivated by the same things? And I do believe that not everyone is as cognitively oriented as we tend to be here, looking for meaning. I've had people tell me sometimes in therapy, you keep asking these questions about why and to make sense of things. I don't care. I don't care. I don't want to understand it. Just make me feel better. And I'm sure you've heard that too. I don't care about the understanding. I once had for a while I was doing a lot of research on my favorite explanation for religion is all about control. So I was doing a lot of research on control, and what do you look to from your faith to help you have a greater sense of control in your life? And I had this Indian student come to me afterwards, and he comes up to me afterwards and he says, you Americans, you're so into control this. You want to control everything. In India, we let things be. We just let things be. We're not into control like this. So your study, it doesn't have any value at all. Well, I mean, he was getting to the root of it. He was saying it's not that relevant to him. He's not motivated by that. I don't know if you have any thoughts about that. Yeah.
Well, your Indian patient, the Murphy, Johnson, and Lohan study, religious coping predicted finding greater meaning in child's death 5 years later. That's a stretch for me. What religious coping is helpful at the time of losing your child, or if you're the pediatrician taking care of those children? what's helpful.
Yeah. Well, I don't remember the precise, the exact items. That one they may have used some general religious coping items, such as I look to God, or I turn to my faith for help in understanding and dealing with the situation. So it's an indicator that they were kind of entering the religious world to come to terms with the loss. So I'm not sure. Don't know about that one. I need to check it out. Yeah.
In a sense, that issue of control seems to me to be the gateway to potential help. Because it's when people think they're in control and they see that everything's out of control that they attack themselves. It would seem to me that teaching them to be able to let go provides the peace that they would be seeking.
Well, I think for many people that's true. And I think in religion in general, as I mentioned, I think it's the overarching purpose it serves for many people is it helps people come to terms with their insufficiency. The fact that we're human, and we have many things in our culture, medicine, psychology, just culture in general, helps people maximize control, but it doesn't help people necessarily come to terms with human limitation. So where do you go for that? And I think the religions of the world have the language of limitation. They speak the language of suffering and grace and forgiveness and transformation and all of the letting go kinds of words. And we don't, psychology broadly defined, I don't think we do so well with it. We're starting to learn how to do it now with some of the new movements and acceptance commitment therapy and mentation and mindfulness kinds of treatments, and we're starting to see the field move towards a greater appreciation for ways to help people accept and let go and to be able to appreciate human limitations. But I think religions have been at it for thousands of years. They've got rituals and practices and language system that's dedicated to it. I think deep down that's my interest in it, really, that there's a whole language system and set of methods that complements traditional psychology and medicine with our heavy control focus. Because a lot of people we see, they're coming in because they're facing aspects of life that are truly out of control. You can't do a whole lot about it. So what do they do with it?
Well, mindfulness, in a way, gets away from that issue of a lot of the words that have been used to help people. It's too many words.
Yeah. Well, thank you very much. I enjoyed this. Thank you.
Hey, John, before we